Welcome to the July the 21st, 2025 Board of Health meeting up in the Commissioners' room. We'll go ahead and call this meeting to order. I want to go ahead and do attendance for the meeting. We have Keith Thackeray.
Here.
Ben Anderson.
Here.
Okay. Julie Beckner.
Here.
And Denise Strasser, not present. Chad Springer, not present. Jen Fife, not present. And Sarah Rich is present. Want to go ahead and take a few minutes to look at the minutes from the last meeting? Anyone want to go ahead and make a motion to approve the minutes from the last meeting?
Second.
Okay. Any seconds? All those in favor say aye.
Aye.
Okay. Anyone opposed? We'll go ahead. And we'll go ahead with the division reports. Randy Myers.
Okay, well, you have the numbers there. But also attached to it is the highlights of the new health code. It's coming, well, actually out now. So giving us a little time to implement everything. It changed all the forms. There's a few additions and changes that changed all the numbers. You guys can have those in next room.
Is there anything that's substantially different than
No.
things were previously?
Now, there's a couple policies, now everyone has to have an employee health policy, signed by each employee. They have to have a written vomit and diarrhea cleanup plan, and posted where the employees can find it. They changed a little bit of terminology, they added some leafy greens and changed terminology, changed numbers and definitions. Now you have priority foundation, and core, instead of critical, non-critical. Priority is something that's immediate. Priority foundation is something that could lead to it, and of course, generally the building and stuff like that, so. We figured it all out. But we started doing some of this, but they're actually not gonna implement it till the first of the year, giving everybody that time to get everything on board. And I've talked to all the people and give them all that same paper and new health policy and the new vomit diarrhea cleanup plan so they can have it ready to go for the first of the year.
Anything else for Randy? Thank you, Randy. And next we will do the environmental health specialist, Kevin Fessler.
Well, you see my numbers there on my report. There's probably two things I should highlight. The tire drive was the 16th of June. We collected 326 tires. We decided to only do it once a year because the numbers have seriously dropped off since we first started doing it. So we did it in Camden. I like Camden because it's more centralized. I think I'm going to do it in Camden again next time. And Hoosier donated the use of a skid steer to move tractor tires. So if anybody knows him, say thanks. Very nice donation. The other thing I want to talk about is something that happened last week on Tuesday. There was a sewer leak at the Blue Moose, and raw sewage came bubbling up in their basement. And as it turns out, Paul Ryder owns a building, two buildings, what is that, west of there? And he had redone some sewage piping and connected to a old abandoned sewer drain that didn't go anywhere other than connected 3 buildings. And so all that sewage was happening to the Blue Moose and the building between. And that was figured out Wednesday or Thursday last week. but there are a lot of rumors about what happened going around, and we've had quite a few people come into the county office asking what we're going to do about it. And so I'm just letting you know that the county's position is that the mess that is made is at this point, the owner's issue to deal with whatever lawsuit or whatever action is going to get taken to get it cleaned up is on them. We have no jurisdiction there. It's the city's responsibility because it's a city property. But an awful lot of people are coming to our office asking about it. And there's not really a complaint, it's just kind of just informing you. So if anybody talks to you guys about it or you hear anything about it, I have spoken with the mayor and he understands that it's their responsibility, and the city probably will be citing Mr. Ryder for a code violation because he did not get a permit to hook up the sewer. He just changed things around. And that led to a pretty big mess for his neighbors. And so we're kind of not involved in it at all. We don't have any jurisdiction there. I have helped them a little bit. I went over there and looked at it and talked with them a little bit about it, but it's not our deal. I don't, you may or may not hear anything about it, but there's some buzz about it. There's been some talk about it on one of the websites, the Facebook pages too, so.
This would really be a sewer problem, right?
Oh, it's a sewer problem.
But I mean, but that's not, I mean, you look at septics, but you don't look at the sewer or the hookups there or anything like that.
No, I don't.
Yeah.
It's not anything that has to do with me. It's all city business. That's why I'm saying that, because we've got a lot of people in the county has something to do with it,
Mhm.
and we don't.
But it's a restaurant, so where does that
The
leave?
restaurant did not cause the mess.
No, I know that, but it is a restaurant affected. So that's a food establishment. So from Randy's standpoint, from the health department standpoint, are we anywhere with that or at this point?
No.
Okay,
But it actually wasn't in the restaurant.
Okay.
It was in the basement for a while.
okay.
It was in the basement. It didn't actually get
Okay.
in the restaurant.
Yeah.
And there's quite a few employees that are there's a couple of employees that are very upset about this. And they wanted it cleaned up about 20 minutes before it happened. And they've made several contacts. Anyway, it's just something that's going on right now, and I thought you might get to talk to you about it. That's it.
Anything else? Any other business? Okay, thank you, Kevin. Next we will have Julia Hoskins, the public health nurse. I will say, I meant to say, remember, that we are recording, everything is confident. If there's any names, try to be confident, please be confidential. So I'm not.
Okay, so there was a couple of mistakes that I found in the chart, so those have been corrected. So it might look a little different. The numbers have increased, the vaccines have increased, which is what we've been working on. Had some new cases of some things. I had 17 animal bites in the past 3 months. Big increase in that.
Is there any trend with those particular animals?
Do what you say, I'm
Is
sorry.
there any trend with that? Is it any particular type of animal? Are these dog bites, cat?
I've had all kinds of varieties. I've had cat, bat, raccoon, dog, and there was another one. I've had several different kinds of animals, so.
So no particular trend then, just?
No, just different. Yeah, they're all different. There was one that was pretty aggressive that I think charges were filed. The dog was put down.
And I did run one down to the lab because we were afraid that was a raccoon that was pretty aggressive. But they killed, and I took the head down to the lab to get it tested.
So you all know that we have an A1C machine, correct? So I've been using that here for a while now. And so on the next page, I went to the Florida utility office for a couple hours and got 15 people to sign up to do their blood pressure and A1Cs. And then not long after that, we had the tire drive in Camden and got some more. And then of course, last week we had the 4-H fair. So I thought I'd mention it, that we got what, 55 or 60 people, something like that, to go through for blood pressures and A1Cs at the fair. So I didn't put it on there because it's not included in the second quarters and the third quarters, but I just thought I'd mention it. So we're trying to get people aware of the diabetes screening, the A1C, so it's working. I'm gonna try and go somewhere different every other week, like at Dollar General or a fire department or somewhere, to get more people involved in like the A1Cs and blood pressures. Know that I'm here because it's, not everyone knows that since Joyce was gone, like, they think that the health department no longer is here, you know, so, because everybody kind of got lost after she passed away, so, I just want to make sure everybody knows that, you know, we're trying to get back to where we were and above and beyond, so. That's all I have.
Julia, can you tell us what you do with your A1Cs that are out of range, just to?
We keep a list, and then we have a callback number. It's optional if they want us to call back. And then we give them a list of like providers if they don't have one, with callback numbers if they want to check up on it. I mean, we can't diagnose, we can only.
Right.
We don't make any diagnosis.
No,
We
right.
can't
We give them
diagnose, we just-
results.
Yeah, we give them the results back, and they take it with them, and I say, just show your primary care physician, or if you don't have one, here's a list that can help you with it, because, yeah, that's all we can do for now.
Oh, thank you.
Yeah.
Yeah.
Any questions?
I do have one more question about the bites, like the rabies, the ones that are, did those people then go to the ED for?
We did.
Thank you. All right.
How many did actually get shots? Do you remember? The rabies shots?
There were several, I would
Yeah,
say,
several went ahead and got
probably
rabies.
5 of the 17 probably got vaccinated.
Thank you.
Of those 5, I think those animals, they weren't all tested though, were the animals?
No, because of either they didn't get caught or they had already terminated it.
Thank you. Any other questions? Next, we have the County Health Liaison, Elizabeth Woods.
I'm currently still working on the Zachary Foundation. That's going to be happening on August 2nd. As of right now, I have 21 students that were signed up, and that was my last update on Friday before the fair had started. We've been pushing it at the fair, so I'm not sure if anybody has signed up since then. She has emailed me back today. At the fair, I did the Hidden in Plain Sight trailer, and that was to kind of help bring awareness of where students might be hiding drugs or other things based in their rooms. I know parents had requested it at one of the board meetings for mental health. I also was passing out Narcan, or free Narcan, and then from there, I went to Helping Hands, which was a recovery community type festival, and I was handing out Narcan there as well. On the emergency preparedness side, I have everything caught up and updated with the MOUs. I did the pod exercises. As far as the grant funding, it was approved for 2026, but they cut my budget by $5,000 for that.
It was previously 25,000.
Yes. And then, let's see, environmental services. I helped organize the tire drive in June. And then Kevin also took me out and kind of showed me how to look for drains for doing the playground.
We have 5 5 lots on 700 South, right on the west edge of the county, which all are gonna need perimeter drains. And we can't find an outlet for a perimeter drain there, so I'm not quite sure what's gonna happen there. I'm still working on that, but I'm on the edge of declaring 5 sites unbuildable for super. I do not want to do that very bad, but we've just about exhausted every possible way we can find. There's Juliet there. Liz and I spent 4 or 5 hours out there one afternoon, and then I spent another 4 or 5 hours with one of the contractors with a backhoe digging around out there, and we never did find anything, so it's not looking real good at the moment. Anyway, that's.
Nice work in getting 21 kids signed up for the ECHO and the Zach McGo Foundation. How many slots do you have available? 60 to 80? Okay. But we don't know about how many signed up for the fair yet, right? Okay, all right, well, good work, you've worked hard at that. Yes, it's a great program. Any other? Okay. And then we have the Vital Records Administrator, Megan Honeycutt. I think it,
Okay, so all the numbers are kind of there. I'd say we've had a bit of a decrease in the amount of death certificates that people are coming to the health department to get. I think that has to do with you can now get them at any county. So I think we took a little bit of a hit there on that, but we do have like the funeral homes and stuff around us that are coming here to get other counties as well, so it may even out. That's pretty much all I have.
any other questions for Megan? Okay. Go ahead with the health officer's report, Dr. Anderson B.
Biggest change from the last visit, last meeting, we had talked about budget being cut about a third from HFI funds for our last Board of Health meeting. That was now finalized and it's cut 70% statewide and our budget was cut 75%. So we had about $400,000 this year for HFI funding. We were allotted $106,000 for the next 2 years, each year. So pretty much everybody's salaries were coming out of that fund, and it's not going to cover it now. So we are going to be discussing the budget with the council in October, and hopefully be able to get some assistance from the county to cover the rest of it. To give a background to that, if you compare to the 2022 funds, the county fund was about $247,000. 2023 county was $248,000. 2024 was $230,000. This year was $195,000. Next year, we would potentially be looking to get $230,000. So that's with the 106. We'd have a total operating budget of about $357,000. So we're not really looking for that much more than what the council has given the health department in the past, but it's a new council. I won't have anything definitive until after the council meeting in October.
I think that's important to point out that it was, the funding used to come through that, and the idea was with this new funding, then you could.
Correct. The idea was the HFI funds would offset a lot of the county funds, but the state did stress that these funds were not supposed to cut the county budget at all. It was supposed to augment the health department, so it's not, I think, my perception of when I started here is that everybody in the county was kind of thinking we would save funds with HFI, but the true HFI goal was to jumpstart public health in Indiana and not cut from the county funds. So aspect, I am gonna show previous funds, history when we discuss in October with the council. Kind of go over what it was and how it was replaced. We used to have the 1206 and 1168 funds, which were state grants, and those are gone. We still have the 9109 emergency preparedness fund, but that one was cut $5,000, so. Yeah. We will have more updates with the next committee on that from a budget standpoint, but at this point, it was a massive cut that was not expected by anyone. I spoke with the State Board of Accounts, regional rep, and she really, everybody was kind of blindsided by this. Because the discussion had been maybe a third cut, not 70% cut. So, I think it's thrown everybody, all the health departments, for a bit of a shock. In that, we have not had any more grant applications come through. I don't necessarily recommend we be too aggressive with any of those funds at this point, because we may need them for salaries next year. So we hold on as much as we can. I think it would probably be wise until we know what the council's gonna fund. The funds that we have allocated, I know we said we were gonna readdress the A1C wellness events. I think that's been going pretty well. Biggest expense with that are the A1C testing cartridges. So we've had, from the swim lessons, we allotted $10,000 last meeting. We've spent $4,000 of that. We have $6,000 left over. So what I would propose is that we take $2,500 of that $6,000 left over from the swim lessons and maybe offer an incentive for anyone that wants to get their kid through a swim lesson program. We could do a gift card reimbursement if they bring us a certificate from the YMCA or wherever they go to get swim lessons. If they bring that back, we give them a gift card to kind of incentivize swim lessons. We could do 100 cards at $2,500 and see how many kids we get, and that could go on throughout the year. The remaining $3,500, I would recommend or offer that we spend that on the A1C cartridges.
And with your costs that you mentioned, I'm assuming the schools have already turned in the invoices or the costs for the summer programs.
It should be processed.
Okay, awesome, thanks.
I don't know if that
Do
needs
you want to
be
take,
voted on that if you
does it
want.
need to be voted on? Well, we are changing.
Yeah, I mean, we're changing that initiative, so
Mhm.
we want to.
Okay. So does anyone want to go ahead and make a motion to spend the $2,500 for gift cards for swim lessons, incentives for swim lessons? Do you want to make a motion?
Second.
All those in favor say aye. Aye. All those opposed? Okay.
And the $3,500 left over from that would be.
Yes. And then I'll go ahead and make a motion, the $3,500 be spent on the A1C cartridges to do A1C testing.
Motion.
I'll second the motion. All those in favor say aye to spend the rest of the money on the A1C cartridges. All those opposed?
Okay. The next thing, and Julie and I have to give you an updated copy of that, because your report doesn't have the chlamydia reports. So we had 20 cases of chlamydia in the county last year total, and we've already had 16 this year. So it seems like we're on a bad trajectory there. I have been exploring options to get some testing kits and pricing availability for doing testing here in the health department. I don't have final prices yet, but I will probably have something to propose to the board at our next meeting. But I think that we still have people call in every now and then trying to get testing here. We don't offer it currently.
What can we do to ensure confidentiality, being that our,
That's the big challenge, is we
Yeah.
don't have an EMR. So that's part of what I'm looking into. We have to have an EMR to record this. It's another cost. Not every health department has an EMR, some health departments do. There are subscription-based ones that we could pay a monthly fee for that would function for that HIPAA compliance, but it may be just a big headache that we want to be involved with. But at a minimum, we may just encourage awareness. The family health clinic is offering testing, so that's very helpful.
Is that where we're referring them to? Family health clinic or their primary care?
And our IURNet.
Okay.
Any of the available clinics, if they're affiliated with one, you can get testing there. It's just a growing problem, it looks like. The thing I wanted to mention is that the Purdue Pharmacy, so the pharmacist, Dr. Kim, is now available to Carroll County residents. Working with ways to make that available and integrate it into the clinics. The family clinics already, because they're Purdue clinics already, so they already have 2 to 3 pharmacists in the clinics at all times, which is a great service to be able to go and talk not just with the physician, but the pharmacist to go over medications and chronic diseases. So it would really be Dr. Dutter's clinic in my clinic, and then anybody that comes into the health department that wanted to talk about any of their concerns with pharmacists would be available. With that comes a lot of resources from the Purdue College of Pharmacy. So if we need to do a large vaccine drive, they can bring out multiple pharmacy students that are capable of doing vaccines. So it does give our nursing team here a lot more support. We're not trying to just do it with 1 or 2 people. And they were able to come to the fair and give out some Purdue slides.
As a clinical pharmacist, is there some availability to do some education to the clinics to do?
Yep.
Okay.
Yeah, and the schools, to be able to, the schools want guest speakers, the pharmacists would be able to do that, and they also are required, clinical pharmacist is required to have proctoring to pharmacists that are still in school, so they help develop lectures too, so that's an opportunity I think that will be helpful to the county if we can get it promoted and all that.
Yeah, I think it's great.
And then they've been doing this in a few counties now, and Tippecanoe County obviously has been doing it most, but it seems like a great service to be able to have to available. I don't think I had anything else.
I know they're gonna help us in vaccine clinics. We're gonna try and have one coming up.
Part of their fellowship requirements are that they help promote awareness with the health departments, educate the public on what the health department can do. And it's all free. So it helps a lot.
Are you gonna have it back to school, or is it for our flu? Are you talking about for the clinic?
Well, it'll be after school starts, but, because they said to wait till October, because they'll have more students to help, so.
Oh, okay.
I figured kind of mix it together and do back to school and flu. Get a bigger turnout, maybe.
Anything else? Any other concerns or matters from the board?
I've got a follow-up question, and I just need to be reminded, I think. Earlier, I don't know if it was probably earlier this summer, I sent out an email to the health department and asked about the program that we had approved up to $10,000 on, and just how we were paying for that. I think my main question was, and I don't remember if there was an answer to that, and there may have been, I just forget. Will the health department pay that directly, or should the school pay that and then get reimbursed from the health department? Because I printed off the email that was sent to me by our school counselor.
The
So-
guest speaker?
Yes, Your Life Speaks, and it's going to be, and so our school counselor to arrange that for both Carroll and Delphi to have the speaker come to both schools.
We had received an invoice for that, and it's been paid directly to,
Oh, it's already done?
yeah.
Okay.
So,
Well, that's easy.
yep.
Okay. So it's already been paid and everything?
Yep.
So I'll let our
It's
counselor
all
know,
set.
and she can follow up with them and
Okay.
confirm that.
Just to follow up on that, because we had said that we wanted, voted for a price that would cover both schools, and they came in under budget, so.
Yep.
Good.
Yeah. Nope, that's what I need, so I can let Hannah know that she got the green light, everything should be taken care of, so she'll be happy to hear that, so.
Okay.
She was just asking me about that today, so perfect timing.
Any other questions, any other new matters? Okay. We'll go ahead and do our next meeting in October. Calendars. So October 6, 13, 20, or 27.
13th is Columbus Day, is that probably closed for that?
Probably closed.
It's my son's birthday.
I don't know if we are or not.
Go ahead and do October the 20th.
That's our
Is that-
health officer's
Office.
wife's birthday. We probably
Okay, that's
should-
probably a bad day to do that. Let's not do that.
That's no big deal, right?
How's the 6th?
The 6th.
Is fine, just with the caveat that I won't be in front of the council until the 8th.
Do we want to wait to do the 20, is the 27th too late?
Not necessarily,
It's fine by me.
Want to do the October the 27th then, so it's after the council? October 27th at 6 PM, here, second floor of the commissioners meeting. Someone like make a motion to adjourn the meeting?
Second.
All those in favor say aye.
Aye.
Aye. Aye. We'll go ahead and shut off the recording.